Today's medical-centric topic is telehealth access disparity, how technology may widen gaps. Why telehealth was meant to improve access. Telehealth expanded rapidly to improve access to care, reduce travel burdens, and connect patients to specialists. For many, it has increased convenience and continuity. However, the same technology that improves access for some risks deepening healthcare inequities for others. The digital divide is the core problem. Telehealth assumes access to reliable internet, smartphones or computers, digital literacy, and private space. Millions of patients lack one or more of these. Rural communities often face poor broadband, while low-income households may share devices or rely on limited data plans. Who is most affected? Older adults, people with disabilities, low-income populations, migrants. Visual, hearing, cognitive, or motor impairments can make video visits difficult without adaptive tools. Technology literacy matters. Navigating apps, logins, updates, and troubleshooting requires digital confidence. Patients unfamiliar with technology may miss appointments or avoid care altogether. This shifts the burden of access from systems to individuals. Language and accessibility barriers. Many telehealth platforms lack robust interpreter integration, captioning, or culturally appropriate interfaces. This can reduce care quality and increase misunderstanding, particularly in mental health and chronic disease management. Privacy and housing constraints. Telehealth presumes a quiet private space. Patients in crowded housing, shelters, or unsafe environments may avoid discussing sensitive issues. This disproportionately affects those with mental health needs or domestic violence risk. Clinical limitations amplify inequity. Certain assessments require physical exams, diagnostics, or procedures. When telehealth becomes the default, patients who already face barriers in in-person care may receive lower quality or delayed evaluation. Payment and policy effects. Insurance coverage, device costs, and reimbursement rules influence who benefits. If telehealth replaces in-person services without alternatives, gaps widen. If it complements care with flexible options, equity improves. Data bias and algorithmic risk. Digital tools may be trained on data from more advantaged populations. This can embed bias into triage, risk scoring, and decision support, further disadvantaging underserved groups. What reduces the gap? Equity-focused telehealth requires broadband expansion, device access programs, simple platforms, multilingual support, accessibility features, and hybrid care models that preserve in-person options. Community-based digital navigation support helps patients succeed. Healthcare's role. Clinicians should screen for digital access and offer alternatives. Symptoms must design telehealth for the least advantaged users, not the most tech-savvy. Clinical takeaway. Telehealth can improve access or widen disparities, depending on design and policy. Without addressing the digital divide, technology risks reinforcing inequality. Equitable telehealth requires intentional investment, inclusive design, and hybrid care that meets patients where they are.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.